According to a recent ICMR study, the number of people living with diabetes in India has increased by 44% in the past 4 years to over 101 million people. This is a major health issue that burdens countries across the world, including India. While managing a chronic condition like diabetes can be challenging, people can take a holistic approach to keep their glucose levels in check. This they can do by modifying their lifestyle, exercising regularly, eating well, and monitoring their glucose levels on a regular basis. With advancements in technology like continuous glucose monitoring to monitor glucose levels, diabetes management can be made simple. Join us today as we deep dive into the diabetes care landscape to discuss how life changing tech such as CGM is helping in redefining disease management so that people with diabetes can live healthier, happier lives. For this conversation, we have with us Professor Ramzi Ajjan. He's the professor of metabolic medicine and consultant in diabetes and endocrinology from University of Leeds and Leeds Teaching Hospitals NHS Trust. We also have with us Dr. Prashanth Subramanian. He's the head of medical affairs for emerging Asia and India from Diabetes Care Division, Abbott. Welcome to this episode, Professor Ramzi. Welcome to this episode, Dr. Prashanth. How are you today?
Doing good. Happy to be here.
Very well, thank you.
Thank you too for coming. Dr. Prashanth, my first question is to you. In many ways, technology has made our lives simpler. How do you think this trend translates to improved healthcare and better management of lifestyle conditions like diabetes?
You're absolutely right. So we've adopted technology like no other planet can, I believe. So for example, none of us now needs to queue to get tickets for any event, travel, whatever, nor do we need to travel to get food. So everything available on your phone, on your palm. So that's also translated the way we take care of health. So with recent advances such as access to health data on your phone in terms of steps, having walked about with your phone or a watch. And also now with the advent of good recent technologies such as continuous glucose monitoring devices, wherein there's a small sensor which is applied to the back of the arm, which is able to measure your glucose levels every minute, and which you scan and get the values onto your phone. And you're now able to see trends to understand how glucose is changing respect to changes in lifestyle to diet to take care of your condition. And this then helps make informed decisions with discussions with the treating physician.
Lovely. Professor Ramzi, for people with diabetes, keeping a continuous check on their glucose levels, it's very important. What kind of tools for monitoring and measurement would you recommend so that people can get accurate, actionable data whenever they need it?
So you're absolutely right. Good glycemic control is important for people with diabetes to prevent long-term complications. We're talking about kidney disease, eye problems, feet, heart and brain problems as well. So what do we do? So we've got the traditional monitoring, like we do an HbA1c, which gives you an average control. It's a glycated hemoglobin, gives you an idea of average control of your glucose. Doesn't give you much about what's happening day to day. It's over 3 months period. So we used to supplement that with what we call SMBG, self-monitoring of blood glucose, that will give us some ideas of what's happening in the sugar. But people had to stab the finger 4 to 8 times a day, which is very difficult to maintain long term.
True.
Now, more recently, we have been having CGM or continuous glucose monitoring that gives you a very broad and comprehensive view of the glucose levels because it measures the glucose every minute and people can't stab themselves 1,400 times a day.
Yeah.
And that helps massively to understand what daily life activities are doing to your glucose, which is very important to the patient, and also helps to uncover some hidden glucose abnormalities that were not possible with the HbA1c and the SMBG. So I think the technology helped here with the management of patient and optimizing glucose control with the use of CGM.
Nice. Dr. Prashanth, how do continuous glucose monitoring devices, how do they elevate diabetes monitoring and management, and do they offer any unique features that can make this process simpler for doctors and for people with diabetes?
Glucose monitoring has been a lot to do with handheld glucometers, wherein patients would first clean the tip of the fingers with the alcohol swab, then prick themselves with the lancet, extract a droplet of blood, put it up into the strip, wait for a couple of seconds, get a value, then decide. And that is a point estimate, or I will know what is my current blood glucose at that point in time. Now imagine if you have to do that 4 to 6 times a day, such as guidelines recommend, you would know that life is not just about stabbing your fingers with needles. So it's a lot's changed with the advent of continuous glucose monitoring. Here, all it takes is that you place a sensor, you apply a sensor on the back of the arm. There's a tiny filament which rests underneath the skin, and this measures the glucose values in the interstitial blood every minute. So it gives you essentially 1,440 readings per day. And it helps populate all of these values in the form of trends with which you wouldn't be guessing as to what will my blood glucose be half an hour from now. Or what was my blood glucose while I was asleep. All of this possible basis the capture of data by these devices and the trends that you can see to take informative decisions.
Lovely. Professor Ramzi, when diabetes is not properly managed, it may lead to other conditions, right? It may lead to heart diseases, kidney diseases. How do you think tools like the CGM devices, how do you think they can help people with diabetes as they try to manage or avoid comorbid conditions?
So you're absolutely right. If your glucose levels are high, you're at risk of complications. It can affect multiple organs in your body if your glucose levels are high. So traditionally, we've been using something called glycated hemoglobin or HbA1c to monitor glucose levels, and that gives you an idea of the average glucose over 3 months. It tells you nothing about how it fluctuates, which is quite important. It's not only important because of the complications, it's important for patients as well because they want to know what's happening with their sugar. So in addition to HbA1c, we used to complement that with SMBG, self-monitoring of blood glucose, where people prick their finger to get blood and look at the glucose in the blood. And that helped to give an idea of what's happening with the glucose as well. But you need to do that 4 to 8 times a day, which is very difficult. Socially can be unacceptable as well. So more recently, we've been using continuous glucose monitoring. So you've got a sensor that the patient is wearing and is checking the glucose every minute. So you're getting a wealth of data, a lot of glucose data that allows you to change the treatment safely and effectively. And not only that, the patient can see the data so they can act because they can see that that meal was perhaps too much, the sugar levels gone too high, or when I did the exercise, actually the sugar levels settled, so they can change their lifestyle, which helps greatly with the diabetes management. So in our experience, the introduction of CGM has revolutionized the management of diabetes, and it helps to get that glucose control, to get the glucose much better controlled.
Thank you so much, Dr. Ramzi. Thank you so much, Dr. Prashanth. That's it for this episode on HealthWise.